Hey guys, welcome back to the channel. Today we're going to be talking about a topic that is asked all the time online, and that is on fungal acne, and more importantly, how to get clear skin if you have fungal acne. We're going to walk through what it is, how you treat it over the counter, and if you need a dermatologist help, what we might prescribe for you in order to help you get clear skin. Let's jump into it. First off, for a quick recap, what is fungal acne and what does it look like on the skin if you have it? Fungal acne is a type of acne that is caused by a yeast that lives on the skin. It comes from the family Malassezia. Now, this is a type of yeast that pretty much lives on everybody's skin, but at low levels. And when that starts to get higher and it's concentrated in areas like the scalp, the face, and the upper part of the trunk, you can get manifestations of severe dandruff that we call seborrheic dermatitis, or if it grows down in the hair follicles, it can cause a little pustule to form, and we call that fungal acne. Fungal acne tends to be concentrated around hair follicles, so we see it on the forehead, we see it sometimes on the back of the neck, on the upper part of the trunk, so the chest or the upper back. We don't tend to see it come down on the face lower quite as much as traditional acne, and it is caused by that yeast that lives on the skin. To contrast that with bacterial acne, or the typical acne that most people are familiar with, that is caused by a bacteria that lives in the hair follicle, and as your body reacts against the inflammation from that bacteria, you get these pustules, you get more redness, which we call erythema, and sometimes you can get deep cystic lesions. When it comes to fungal acne, it's rare to see deep cystic lesions. The most common appearance of fungal acne are small pinpoint papules that tend to all look the same. We call that a monomorphic appearance, or one morphology. So we have lots of little bumps all along the hairline or along the trunk, and sometimes if it's appearing on the back, it will go down much further than we typically see acne vulgaris, or bacterial acne. Bacterial acne tends to be concentrated on the upper part of the back or the shoulders, whereas fungal acne is a little more likely to grow down further past, the thoracic spine. And one characteristic of fungal acne is that it's more likely to be itchy than bacterial acne. Many people online tend to ask, will fungal acne go away on its own? And yes, this is possible. There's certain circumstances that led to the development of fungal acne, whether it's just the oil that your skin produces, the diet that you have that contributes to that oil, and the types of little nutrients that are inside of there that the yeast feeds off of. And if you change your diet, or you change your workout routine, or something else about your shower routine, it has a chance to improve. But if you want to treat it over the counter and you want to get clear skin as fast as you can while you have fungal acne, I'm going to share with you a few of the products that I would recommend that you look into in order to get clear skin. Let's first talk about cleansing the skin with fungal acne. Some of the products that I recommend my patients look for over the counter, and some of these have prescription variants that I may prescribe, are actually going to be dandruff shampoos. Because dandruff is also caused by this Malassezia yeast, you can use these things as a cleanser on the skin, even though they're formulated to be a shampoo. The most common recommendation that I have is Nizoral shampoo. You can get this as 1% ketoconazole shampoo over the counter, and I would recommend that you use this as a face wash. If you have significant fungal acne, you can start by using it daily, but when you get into a maintenance phase, you can go down to 2 or 3 times a week, and you should be able to maintain clearance. Now, in order to get the best effect from this, you need to wash it onto the skin. You can just use your fingers and rub that onto the skin, whether it's the face, the chest, the back, the shoulders. And I recommend letting it sit on the skin for 5 to 10 minutes before you rinse it off, and that will help give the medicine time exposure to the little fungus, the yeast that lives on the skin, and actually kill it and help you to achieve clear skin. Most people are not going to get a lot of irritation from the shampoo, and so this is safe to use daily in the initial term, but like I said, you can back off and use it less frequently as your skin starts to clear up. Along with Nizoral shampoo, you could consider using other anti-dandruff shampoos, and these are going to be brands like Salsa Blue or Head and Shoulders. Some of the unique ingredients here that can help to fight this yeast are going to be sodium sulfacetamide, it's going to be zinc pyrithione, and these have antibacterial and antifungal actions against these little yeasts that live on the skin. And the principle is the same. If you're going to be applying these to the skin, I recommend using it as a face or body wash and letting it sit on the skin for 5 to 10 minutes before you rinse it off in order to get the best chance at success. Next, we're going to move into topical treatments that you can use after cleansing in order to help clear up fungal acne. An often overlooked ingredient in the treatment of rosacea, bacterial acne, and even fungal acne is going to be sulfur. So sulfur has many antibacterial and antifungal properties, and so using a topical preparation of sulfur can be really effective. I'm going to link a few brands below down in the video description, and the main brands that I typically recommend patients look for are going to be Naturium, Dermalogica has one. There's a few other brands, and we'll link those below. You can find one where the price point works for you. But a word of warning with sulfur, it doesn't smell very good, and so this may be something you want to use at night. Some of the brands do a better job of masking that smell than others, but it may not be something you want to put on and then head out to school or head to work, because sometimes it can be a bit odoriferous. When using the topical sulfur preparations, wash your face first, let it dry, put on the sulfur. You can moisturize afterwards in order to help repair that moisture barrier, and then go ahead and go to bed. Now, I don't often recommend essential oils because I do think they have the potential to be irritating and sensitizing to the skin, but there is some potential benefit from tea tree oil here. I wouldn't put straight tea tree oil on the skin, but products containing tea tree oil can sometimes be beneficial here. I would recommend that you stay away from a lot of other oils, however, because this yeast feeds off oil. So definitely don't be using things like olive oil, avocado oil, anything like that on your skin, because it may actually end up making the problem worse, contributing to more fungal acne or flaking in the scalp. Now, if you've tried these things and they're not effective, what can you get if you go see a dermatologist? Here's some things that you might ask for if the diagnosis you suspect you have is confirmed by your dermatology provider. When patients come to me for fungal acne, I do often still prescribe Nizoral shampoo. We're able to prescribe a 2%, so it is stronger than the one that you can get over the counter, and the instructions remain the same. You're going to apply this to the face, chest, back, or shoulders, let it sit on the skin for 5 to 10 minutes before you rinse it off. I'll have my patients do that 2 to 3 times a week, and they may supplement with another cleanser or anti-dandruff shampoo during the days off from the prescription. If I see a patient with fungal acne, additional topical medications I can prescribe include ketoconazole cream or econazole cream. These are topical antifungal medications that may help to clear that up a little bit faster. Sometimes if it's significant, especially if it's going all the way down the back or there's a lot of hair follicles involved, we're going to need to move on to an oral antifungal medication. And the most common go-to for fungal acne is going to be fluconazole. Diflucan is another name for it, the brand name. And this is a pill that can be taken once a day, or sometimes I'll even prescribe it just once a week. It does come out in the sweat gland, so I often tell my patients to take that pill and then 30 minutes later, go ahead and go exercise, go work up a sweat, because the medicine's going to come out, it's going to be put into the hair follicle where that yeast is living, and it's going to stand a better chance to help clear that up a little bit more quickly. It's important to know that these azole antifungal medications like fluconazole can interact with other medications, so it's important to share with your doctor any other medicines that you're taking or over-the-counter supplements, because there can be some interactions, especially if you're on medications for high cholesterol. If you're taking a statin, for example, it's something that you want to watch out for. Some of those oral medications don't play well with alcohol also, so just make sure you discuss that with your doctor and make sure all your questions are cleared up before taking any pills to treat fungal acne. Now that you've got some products or maybe even some prescriptions to treat fungal acne in order to get clear skin, the most important tip that I can give you is to be consistent with your treatment. Follow the directions that I've shared here or that your doctor gives you if you're getting prescriptions, because it's something that you have to treat consistently in order to get it away and keep it away. If you are prone to getting fungal acne, if you have it, there's a really high chance it could come back with time. And so that's where the maintenance really comes in, using that Nizoral shampoo 2 to 3 times a week, kind of in perpetuity. And maybe it's only a seasonal thing for you. Maybe it comes up in the summer, so make sure you're stocked up on the right products heading into the summer months. and maybe you don't have to use them as much over the winter. But be consistent with the regimen that helps you to get and keep clear skin, and you're likely to enjoy that clear skin much longer. Hopefully covering some of these topics was helpful for you, both to know what fungal acne is, what it looks like, how to treat it over the counter, and what kind of prescription medications might be available to treat fungal acne should you need to seek the care of a physician. If you guys found this helpful, go ahead and hit that subscribe button. Leave me a comment down below if you have dealt with fungal acne, and I look forward to seeing you guys back on the next video to discuss additional topics that you might request. I'll see you there.